Asian double eyelid suture technique. Hi, I'm a 31-year-old female and had double eyelid surgery with a non-incisional suture method. It's been 2 weeks and 2 days. I think the height of my crease is really high. When I measure, it is 1 centimeter in height. The left eye is bigger than the right when my eyes are open, but it's the same measurement. Is this due to the left eye, which is still more swollen than the right? Will the height of the crease reduce after a couple of months? The surgeon said they did 7 millimeters, but I'm not sure if this is true. Please help.
Thank you for your question. So it's been 2 weeks and 2 days since you've had your non-incisional Asian upper eyelid surgery, and that you are describing an asymmetry in terms of the height and swelling, and you've measured the crease as being 1 centimeter, which is 10 millimeters, and the surgeon reassured you that the surgery was done at 7 millimeters, and you're questioning whether or not that was actually true. Well, this is where it is not an unusual situation where swelling most likely is the basis for this discrepancy and this difference. When eyelid tissue swells, it can expand significantly. Think about anyone who gets traumatized in the eye or rubs their eye too much from seasonal allergies. The eyelid can swell tremendously. So, surgery is controlled trauma. And understanding that we're looking at the eyelid crease to margin platform, which is measured preoperatively at 7 millimeters, and the swelling can certainly account for the additional 3 millimeters that you are measuring. Now, your surgeon and your experience and having this concern or anxiety is something we're no stranger to. And so I always tell my patients that, especially with a non-incisional procedure, this is a procedure that where no skin was removed, and that it is a function of anchoring the skin to the levator muscle. I always explain that, nature gives us a certain amount of room to work, and it gives us permission to create a crease up to a certain level. And that also is applicable to other procedures, where going beyond that is too much and it'll fight back, or situations where it'll be a little too high or a little too unusual. You're looking at 3 millimeters at the 2-week point. Most likely, your eyelid crease will settle to close to the original position that the surgeon intended to place. More importantly, the aesthetics. Instead of measuring, you just need to continuously look at yourself and watch and see how things progress. In our practice, we see people within the first week to 2 weeks, and then at 1 month, 3 months, 6 months. We really follow our patients closely, and the door is always open for our patients to call or come in for any concern. So you'll be impressed, I think, that by watching, if they take regular photographs of your eyes, how much little bits of swelling can change over time and really settle into looking good. So I think that the advice I would give you is to wait. I think sometimes when people measure things very carefully, the perspective starts to really change, because when you look at something, when you focus on something, then little things become big things. And what I always tell people is to just kind of step back and see how things are. So I would advise you to continue communicating with your doctor and make sure that you don't try to intervene or do something that your doctor is not aware of. So it's important to work together. So I hope that was helpful, and thank you for your question.